Welcome to the next Ritwells podcast episode. Today with us is Dr. Baki Erdem. Welcome. He came from Turkey just for the podcast, so I feel very privileged for that. How do you feel today, Doc?
I am very happy because I want to thanks you because very nice organization.
Yeah, thank you.
I hope it will very well.
Yeah, thank you. Okay, I'll start with the questions immediately. So, what is a gynecologist oncologist?
Gynecology oncology is related gynecologic cancer, ovarian cancer, uterine cancer, cervical cancer, vaginal cancer, and vulvar cancer. But we are not related not only cancer but also other gynecologic operation. For example, myoma uteri surgery, ovarian cyst, uterine prolapsus, urinary incontinence, endometriosis. So we are interested all gynecologic operation, especially difficult operation.
Right. And what is the most common from these that you just mentioned? Which ones do you face the most? I hear people say that. I've heard that a lot of women are struggling with endometriosis. That's something that's very, very, very common. But which cases do you face the most?
Endometriosis common problem in the world,
Mm.
especially it cause pain and infertility. Most of patients come us because of pain,
Mm.
lower back pain and abdominal pain, and endometriosis causes infertility. Most of patients want to baby,
Right.
we perform uh, surgery and medical treatment for endometriosis.
Yes, a lot of women, as far as I have heard, don't know that endometriosis causes infertility. So it's very nice that that's the first thing that you mentioned, that endometriosis causes infertility, and apart from the pain, because everybody focuses on the pain. But before we deepen into endometriosis, can you tell me which cancers, which gynecological cancers are the most common? What do you face the most in your practice?
Endometriosis can cause ovarian cancer sometimes, especially after 40 years old.
Okay.
uh, One or two times elevate risk for cancer. So sometimes we can operate this endometriotic nodule, especially deep endometriotic nodule,
Mm.
because when deep endometriotic nodule cause high pain and ovarian cancer.
Right. And does it often come to the ovarian cancer because they didn't diagnose it at the time? Because they often say that it takes a lot of years to diagnose endometriosis, sometimes 5 to 7 years, right?
Yes.
Yes. And does it uh, does it is the fact that it's late diagnosis cause that women often progress to ovarian cancer, or is it just something else? Is it genetics, or how can we prevent late diagnosis in endometriosis?
Uh, Early diagnosis is important for endometriosis. We have to follow closely endometriotic cases because ovarian cancer, unfortunately, we cannot catch early stage.
Right.
Generally, ovarian cancer we can catch advanced stage.
Mm.
But if she has an endometriotic nodule, if we can follow closely, maybe we can catch early
Right.
stage.
And what's the best way to diagnose endometriosis? Like, what are some methods that you do or you would
Firstly,
suggest?
pelvic examination is important. After transvaginal ultrasound, imaging is
Mm.
important. Sometimes we can want see MRI,
Right.
magnetic resonance imaging,
Yeah.
but generally A pelvic examination and ultrasound is
But
enough.
a lot of people fail to diagnose that through only through that, and sometimes it happened that through laparoscopic findings they could
Yes.
see. Yeah.
Laparoscopy is gold standard.
Mm.
Uh, Laparoscopy is minimal invasive surgery,
Yeah.
but endometriosis, at endometriosis, we can firstly perform ultrasound, pelvic examination after laparoscopic surgery. If we endometriotic nodule, we can remove all nodule and we can correct all area.
Hmm. And what would you say for in some cases, some people who some doctors actually who do the diagnosis, they do the pelvic examination and they do the ultrasound, but they find nothing. And the woman keeps complaining that she has extreme pain. And she
Yes,
believes, based on now we know that everybody reads today, they try to, we cannot gaslight our patients by saying, no, this is just Google doctors, you can't
yes,
do Google doctors. People read and they know something, and most of the women know more about their bodies more than the doctor, because the doctor sees them only a few times a year. So how do we stop gaslighting our women when it comes to the pain and endometriosis, and what should a woman do in the case that she keeps feeling pain and through pelvic examination and all that she's still not diagnosed with endometriosis?
yes. High pain is important because most of patients live dysmenorrhea.
Yeah,
Dysmenorrhea
dysmenorrhea.
is
Yeah.
normal, but sometimes it big problem. It can be big problem during the menstrual period,
Hmm.
and out of menstrual period, patient feel abdominal pain, leg pain, and back pain. A lot of area we can see.
Yes.
So, in this case, we firstly we recommend gynecologic examination.
Hmm.
After laparoscopy, we can think.
Yeah. Okay. And what does the science say? Are the non-invasive methods improving nowadays? Like the improving the development of early diagnosis? Because I feel like we have a very big gap in early diagnosis when it comes to endometriosis in the world.
Yes, firstly we give some medicine, hormonal therapy,
Mm.
before surgery.
Okay.
If hormonal therapy improve patient healthy, then we don't recommend operation.
Right.
But uh, no answer hormonal therapy, then we recommend laparoscopic surgery.
What are some other signs when it comes to endometriosis? Like, how does endometriosis impact performance and mood and cognitive function in women? How does it affect their general state?
Endometriosis affect badly women in social activity.
How?
Mo- because most of patient doesn't go to work.
Yeah,
Yeah,
that's for one. Yeah.
because pain is high,
Mm,
powerful.
right.
So in this case, we can intervene
Yeah.
with hormonal therapy or surgery.
When a patient comes to you, how do you approach her? Because I have to really focus on the fact that a lot of problems with early diagnosing is that a lot of doctors don't take into consideration that the women are really struggling in that, and it many years can pass. They focus only on the fact what they see in pelvic examination or the ultrasound, and they keep saying, oh, it's nothing, you don't have endometriosis, and then 5 years later it turns out that they do. So how do you approach to the women patients when they come to you?
No, we don't anything. We don't see anything
Mm,
endometriosis.
yeah.
Then we recommend laparoscopic surgery because patient has a big pain.
Yeah.
It is
Yeah.
important.
Yeah. Are you
We we have to solve this problem.
Yes. Is it easy for you to do the early diagnosis based on your practice?
Yes.
Are you good with that? Yeah. And how do you, what are some common symptoms that you immediately know that is endometriosis, even though the tests don't give you even though you don't have the physical result, but you're pretty certain that it is endometriosis? What are some common symptoms that you kind of know?
Sometimes patient feel bleeding,
Mm-hmm.
rectal bleeding, for example,
Yeah.
and stomach bleeding, and hemoptysia. Endometriosis can place other area, for example, bowel, and eyes and nose,
Oh,
and
wow.
yes.
And how the eyes and nose? That's interesting. Yeah.
In patient feel during menstrual period
Uh-huh.
bleeding from
Right.
nose or eyes.
Wow. Okay.
Interesting cases.
Yes.
There is interesting
Yeah.
cases. I saw a lot patient.
Mm-hmm. And is there how does endometriosis affect infertility? This is very
In
important.
fact, generally endometriosis destroy fallopian tube,
Yes, fallopian tube, yeah.
and so sometimes uterine cause into uterine anomaly.
Mm.
Sometimes ovarian dysfunction caused ovarian dysfunction, and so we want to some ovulation hormonal test.
Mm-hmm.
We decide result of test and ultrasonic examination.
All right. And what do we know about why endometrial-like tissue grows out of the uterus? What does the science say? What do we know about that part? Just to explain to people a little bit. Why does the endometrial-like tissue grow outside the uterus?
Uh,
Is it known? Or
Actually,
yeah,
it is there is different hypothesis.
yeah.
For example, endometriotic gland go other side, and it can place another
Mm. A role.
tissue,
Yeah.
and it can grow,
Yes.
and maybe immunologic system and genetic is
Yeah,
effect.
this is what I wanted to ask because it's always a battle between immune system failure and hormonal imbalance.
Yes.
Like it's always a fight between these two. And what does the science say about the genetics and epigenetics? In how does that play a role in immune dysfunction? Is it more like the immune dysfunction, or is it the hormonal imbalance, or does the immune dysfunction cause the hormonal disbalance?
We can say all
Mm-hmm.
hypotheses,
Yeah.
immune deficiency and hormonal imbalance, but especially genetic is important.
Yeah.
Genetic effect.
And in because it's a genetic effect, how can we say that lifestyle changes and factors the way we live our life, and what do we do with training and nutrition and sleep? How does that affect this?
Yes, regularly sleeping is important, and fatty food is dangerous for endometriosis.
Mm.
It cause endometriotic nodule, can cause growth endometriotic nodule, and she feel she feels pain. Maybe
Hmm.
it can cause infertility. So
Yeah.
we recommend no fatty food, and sportive activity is important
Very
for
important.
endometriosis
Hmm.
prognosis. Uh, Generally,
Yeah. And since because we got deeper into endometriosis and forgot the cancers a little bit, so is it possible to cure gynecological cancers?
we are very lucky this topic because especially uterine cancer and cervical cancer cause vaginal bleeding.
Hmm.
If patient go to hospital during the vaginal bleeding, we can catch early stage. Especially uterine cancer generally cause vaginal bleeding in early stage,
Right.
but cervical cancer in advanced stage cause vaginal bleeding.
Hmm.
Uh, Ovarian cancer generally, we can not catch early stage because ovarian cancer doesn't give any symptoms early stage. Only advanced stage, abdominal swelling, abdominal pain, constipation.
Right. And what's the prognosis for the woman who has an ovarian cancer? Is it
Ovarian cancer prognosis generally bad
mm,
because we can catch uh, 75% patient advanced stage.
wow.
So if we can operate after has to take chemotherapy.
Okay. And what cancers do you face the most? What have you dealt with the most? Or is it just a kind of a equal number?
Firstly, uterine cancer,
Mm-hmm.
respectively, ovarian cancer, cervical cancer. But we are very lucky. Why? Because for cervical cancer, there is a screening cancer test and vaccination.
Okay.
Vaccination is important for cervical cancer
Why?
because cervical cancer, HPV virus cause cervical
Yes.
cancer.
Yeah.
Yes,
Type
vaccination.
16, I think.
Yes,
Yeah.
type
Yeah.
16, 15
15.
is the most common and dangerous type.
Yes, a lot of people have HPV, but they don't know. So it's how do we? It's good to do tests, right? To check in order not to get to the cancer stage.
Yes.
Yeah. Okay. So tell me a little bit about. Tell me some details about the Gynecological Oncology Council. I think you have it in Acıbadem, right?
Yes, tumor council consists of different departments.
Mm.
First, the gynecologic oncologist, general surgeon, medical oncolog, radiation oncolog, nuclear medicine doctor, pathologist, radiologist. We decide together. First, we examine all patients together, and we see radiologic imaging, and
Mm.
we
So maybe that's the good part because you do the follow up from the start. It doesn't the patient doesn't have to go like from a place to place, but you gather together and take all symptoms and complaints of the patients into consideration to come to the best or to earlier diagnosis and to the best solution.
yes, if we early stage cancer,
Mm.
generally we prefer operation.
Yeah. So because that's the best solution,
Yes,
right?
best
Yeah.
solution is
Yeah.
especially uterine cancer and cervical
Yeah.
cancer operation.
Yeah.
But ovarian cancer,
Mm.
operation and chemotherapy.
Do we have more treatment options for gynecological cancers today compared to 20 years ago, for example? What do you think?
Yes, medicine is advancing rapidly. And
Robotic surgery, for
robotic
example.
surgery,
Yeah.
laparoscopic surgery.
Yeah.
This name minimal invasive surgery. We performed this minimal invasive surgery, especially robotic surgery and laparoscopic surgery is big advantage for patient. Why? Because we can open a small hole on body,
Yeah.
no cutting.
Yeah. 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 Very
So
important.
patient feel less pain
Yeah.
and rapidly
Recovered.
discharge
Yeah.
and rapidly recovery,
Right.
less wound infection.
Yeah. Can you share a story of a patient that remained in your heart, something that had a lasting impression in you?
Yes, 10 years ago, there is one patient, but she had no baby. She wanted to baby and she took a lot medicine for infertility. And she had, she was pregnant, but we diagnosed ovarian cancer during the
Mm.
pregnancy. And we told her and we said operation choose, but firstly she didn't want to operate, but we could operate, and she was very healthy. And after operation, 5 weeks later,
She
she delivery
gave birth.
gave birth.
Yeah. And what method did you use? Was it hard?
Yes, yeah,
Was it a hard surgery?
heart surgery, because it was big operation, and we cut big incision,
Mm.
umbilicus above, umbilicus under, big incision, but we protect baby.
Yeah.
Baby. Unfortunately, after delivery, we remove all uterus and both ovary.
Yeah. Do you have many cases where you, for example, people with women with endometriosis come to you and they have been told that they can't give birth to children, they can't conceive, they were so lost and didn't know what's up with them, and you could immediately say that we're dealing with endometriosis here and start doing treatments.
There are different treatment choose. Firstly, I said before, hormonal therapy. First,
Yeah.
first option.
Is there a lot of cases though that come to you underdiagnosed or undiagnosed? Do you
Yes,
have, yeah, yeah. Why do you think, what happens? Why is this a problem that so many women can't get properly diagnosed? What is the difference between you and, for example, most of the doctors who can't diagnose endometriosis?
because sometimes it is confused for
Mm,
endometriotic diagnosis,
yeah.
because most of ill cause pain, abdominal pain, ovarian cyst, myoma uteri. Most of doctor cannot think
Hmm.
endometriotic
Why?
problem,
Why do you think that happens?
because sometimes it is not seen.
Hmm. Yeah.
And on examination, pelvic examination,
Right.
and transvaginal ultrasound.
Mm.
So laparoscopy is important. I
Yeah,
said
yeah,
before.
yeah, yeah. So if, let's say, I would like a second opinion, I could go to the official office here in Pristina and then have sort of reach out to you in Turkey, right?
Yes. I am ready for second
For
opinion.
the secondary opinion, yeah, yeah, of course. And you, like, your expertise and the Acıbadem expertise is the fact that they have a lot of advanced technology and the robotic surgery itself, right?
Yes, Acıbadem Hospital is the most elite and most the biggest hospital in Turkey. I think in the world, in the Europe.
Mm-hmm.
So we have very lucky. We have advanced technologies. For example, robotic surgery, laparoscopic surgery is the common devices, and hyperthermic intraperitoneal chemotherapy is a big advantage for patients.
Yeah. How? That's a very special one.
Yes,
Yeah.
hyperthermic
Can you tell me more about it?
hyperthermic intraperitoneal chemotherapy generally we use at ovarian cancer. Firstly, we can operate patient. After operation, we use hyperthermic intraperitoneal chemotherapy. It is useful. It is benefit for patients. Uh, we have this technology.
Okay. Thanks a lot for being here, Dr. Baki, and I hope to see you again.
Thank you.
Thanks for being with this Ritwells podcast episode. See you in the next one.